Hello, everyone. Welcome to this episode of Pharmacy Pathways. Today we have Darryle Tillman. He has been a pharmacist for 25 years. And last year he was the vice president of the pharmacists of the Pennsylvania Pharmacists Association. And this year he is the president elect. And he also is on the board of trustees for the Pennsylvania Farm Pack organization. So he is going to be talking to us about why it's so important for us as pharmacists to be advocates of our own profession, of our own careers, and how we can get involved, whether that's us not knowing anything at all about which organizations to join, or for those of us who already have our foot in the door, and how we can continue to climb that ladder to make sure that our voices are loud and clear. So without further ado, I introduce to you Darryle Tillman. Well, thank you for joining.
Hello.
I would love for you to give us a little bit about yourself. I gave the major points of your life, but I would like you to share how you got into pharmacy, who is Darryle Tillman, and how did he get to, president-elect of the Pennsylvania Pharmacists Association? How did we get here?
That's a mouthful. I often think to myself that my brothers and sisters in Pennsylvania went to the corners of the earth to get their next president-elect, but I'm very grateful, very humble for the opportunity and the privilege to serve them. Background, I'm a kid from Philly, born and raised East Mount Airy section of Philadelphia. Was fortunate enough to go to Central High School. Shout out to Central High, my graduating class 253, 253rd class of Central High. Grew up there, and when I was in high school, we used to have this thing called the Sunday newspaper. I don't know if people are too familiar with that anymore.
Yeah.
And it came about that. And then one of those sections in the classifieds, they always had a career that they would feature on Sundays. And my father actually made me and one of my sisters read that growing up every week. Came across pharmacy, figured it was something that I could help people. It had set schedule, fixed hours, wouldn't see any blood and guts, and it made a good career. And, you make a decent payday. But life has turned that I went into hospital pharmacy, so I don't have really a set schedule. I work weekends, holidays, overnights. I worked all the shifts. So I discovered pharmacy. I think I was a sophomore at Central High when I discovered it. Took a few classes at Central, took pharmacology with Mr. William Brooks. Shout out to Mr. Brooks out there. I also then joined the program, an enrichment program. I was very fortunate to have gotten a scholarship to go to Philadelphia College of Pharmacy through their prep program, because at the time minorities were so scant in pharmacy. There was not a lot of Black and brown people. There were not a lot of people from underserved communities. And so they created this half scholarship. So that allowed me to go to PCP. And I was in the last Bachelor of Science class to come out before the entry-level PharmD was mandatory throughout the profession. Came up to Reading, Pennsylvania, which is about 70 miles northwest of Philadelphia. And let's see how life is from someplace outside of the city. And just took off from there. Been at Penn State Health for 25 years now. I currently am doing hematology oncology work, we call it HEMONC for short, in the cancer center. So I take care of cancer center patients, and patients who have different blood disorders like anemias. But as far as my service to the Pennsylvania Pharmacists Association, I was actually the Berks County Pharmacists Association president back in 2010. And did that for a while. Got an opportunity because I served on some committees with the Pennsylvania Pharmacists Association. We call it PPA for short. And was doing some legislative work for them, some advocacy work, did a few other things, was talked to by a few people who I consider mentors for running for the board back in 2015. Got elected, served 2016 to 2021 as the health system member of the PPA board of directors. Took a couple years. I got term limited. We only can serve up to 2-year terms on the board, and wanted to practice or regional seats. So I took a couple years there where I kind of just decompressed. I still was involved. I was still serving as a Farm Pack Board of Trustees member, and I did a couple other things with PPA with some of their committee work, but just was enjoying my wife and daughter. And then the call came from a couple different people to step up into leadership as an officer. And I had the privilege of getting elected a couple years ago, vice president. Last year, I got elected as president-elect. I'm serving as president-elect now. Will serve as president in 2026.
The journey, everything positioned you for the next call, for the next position of leadership. And I'm just really excited to have you. My previous guests have really been more of my age group, and it's really nice to talk to somebody who has more insight over how pharmacy has transformed over the years with a larger scale of years, because even when I was learning about pharmacy back in 2011, 2012, it looked very different. By the time I got into actual pharmacy school, it was changing when I actually had my foot in the door, when I was in the classroom and hearing about the updates. So I would really like you to talk about that before we get into the work that you do and why you encourage people to advocate for the pharmacy profession. How have you seen it change over the past 25 years?
There's so much change. We could be here all day. So let me summarize it in a couple different buckets. First, when I went to pharmacy school, 94, fall of 94, it was still mostly men. It was still mostly men. There were very, very few people of color. There were very, very few people who were coming from underserved areas. And in just the 5 years I was in school, 5.5 years I was in school, it actually changed a lot, where women were making up half of the class. Now women dominate the profession. Women are the majority of pharmacists. The second thing that is a major change is how we practice, right? So when I came out of school, we were still very much a distribution service with some clinical aspects. And a lot of the call then was to save money, cost savings. How can we do this at a more affordable cost, right? For not just the patients, but for the institutions, for the profession as a whole, so that we could show our value. Now that's changed, and you see pharmacists now in clinical roles that they are becoming revenue producing people. And we are using more and more of our knowledge base and less of the distribution phase. We have actually phased a lot of the distribution to our technicians, which we didn't do in the past. So the technicians now take a lot more of the distribution responsibilities with oversight of the pharmacists. But the pharmacists are now leading more and more clinical roles in various avenues. You see pharmacists specialize in cardiology, critical care, and emergency services, and population health. That's the second bucket. And then in the third bucket, I would say that we've dealt with challenges of different entities who don't want us to advance. Those are middlemen, pharmacy benefit managers, not all of them, but unfortunately, 3 of them make up the overwhelming majority of the market, over 80% of the market. So we've had issues with them and their control. It is harmed pharmacists, it is harmed pharmacy, and most importantly, it's harmed the patient, because the patient has lost access to the pharmacists in the pharmacies. And if you really think about it, we're the first step in the healthcare journey for most people. We are the people, you see your doctor a couple times a year. Depending on how sick you are, you're seeing your doctor, maybe if you're a cancer center patient, you see the doctor every few weeks, every 3 weeks. But outside of cancer center patients who are actively battling cancer, most patients are seeing their doctors a couple times a year. You can see the pharmacist every day. And if you're just on one medication, there's like 12 touch points a year to see your pharmacist, right?
And I believe because of that access that they had to us, we were the number one trusted medical health professional. And that has since changed. I don't believe we have that status anymore.
No, we do not have it. It's a shame, because we didn't do anything differently than what we were doing. which was taking care of people, right? That's what we did. But attitudes and perception about us changed due to dynamics outside of our control.
I have seen some of that myself, but it is very interesting from your viewpoint. In 1994, I was 2 years old. Wasn't thinking about a job yet.
Let me see. In 1994, I was 18. So,
well, I
decided
to go into pharmacy school when I was a sophomore in high school. So that was my introduction. I actually was introduced to pharmacy at a major chain that was right up the street from me. And I wanted to be a pharmacy store manager in retail. That changed as well too. I just ended up going the clinical route. And by the time I was in pharmacy school, we had curriculum that was really focusing on that. And to the extent I would say really encouraging and influencing us to really highly consider clinical pharmacy as a position, as a role. So that definitely had a lot to do with my choice and where I went in pharmacy.
One thing I want to caution all pharmacists is that every job is a clinical job. They like to define buckets, but let's be honest. It doesn't matter if you're in a community role, a health system role, a managed care role, any role out there, you have the opportunity to be clinical, right? Like, I don't need to physically be at the patient's bedside to be clinical. I just need to have access to the information to make a clinical decision. So I can do that from anywhere and in any function, whether I'm staffing the pharmacy on a weekend or a holiday, to I'm being assigned to go talk to or counsel a patient, not just on new meds or old meds, but to do a chart review. There's
that is true. You have the opportunity to use it, but if I believe, to be the devil's advocate to that, if you're in a position that doesn't give you the access to that information, right? At the retail level, you don't have access to their labs. There's only but so much you can catch on the clinical level.
Yeah. But you can get a lot from the patient. There's still opportunity to get a lot of information just having a quick conversation. Hey, how you feeling, Mr. Smith? How you feeling, Miss Jones? How you been taking this med? Have you noticed, you can start asking about, have you noticed leg swelling or something, an adverse drug event, and start to ask questions to filter out information that can help you make a determination. Hey, this patient's been on this medication. This was a new start from 2 months ago. Sounds like we're getting some adverse drug events. Maybe go and have a conversation with the physician. And most physicians are receptive to the conversation. They may not take your advice, but they'll at least have the conversation with you, and they'll explain to you why they won't take that advice at this time. And I respect that, because they have the overall picture, whereas I'm looking at one portion of it.
And to that point, I believe that pharmacists had the ability to do more of that assessment with the patient when there was more time to do that. And that has also been something I've heard from friends in the retail space, that they don't have the time to utilize those skill sets because of the demand or how the environment has shifted.
Well, the margins are so tight on the community pharmacy aspect, and they become tighter because of aspects of the contracts with the PBMs and some of their practices. So, even the biggest of big boys are having, margins of 2% or less, which makes it very difficult to have a lot of time other than do volume. What we have to do is we have to change the mindset of just looking at your business, your operation, your practice as a distributed function, to the mindset of, okay, I'm not going to worry about how much money I make, or do I even break even on just the aspect of dispensing medications. Let's look at the overall patient care. And in Pennsylvania, we've had a lot of opportunities to do that via our PPCN Pharmacy Care Network, our Pennsylvania Pharmacy Care Network. Also we just got opened up a year ago to being provided advanced practice provider status by PA Medicaid. So that allows us to take our Medicaid patients, which are all these underserved communities. I think it's like 59% of Pennsylvania is considered an underserved community. So there's a lot of Medicaid patients that have the opportunity to get, that we have the opportunity to give advanced care, get paid for those services. And we know that the return on investment, if you look at all the studies, are anywhere from 2.5 to 4 to 1 on the return on investment. So it behooves payers, entities like the state, to provide payment to the pharmacist because we're saving them money.
And just the way that you approach that with that mindset and with that background is something that I don't believe that we covered much in our curriculum. And I want to go back to kind of how this gap of pharmacists that are graduating and getting into the workforce and just going about our life essentially, and not circling back to figure out how we can help advocate the field that we're in, right? The same field that we have the frustrations regarding, the same field where we tend to feel a little defenseless. This may be my personal opinion, but in pharmacy school, I don't feel like I was equipped to understand how important it is for me to be involved with organizations, especially at the state level. Pharmacists are not, they tend not to join their state organizations. We really didn't, I don't think that really came across in something that we need to be focused on, or why we need to be focused on that. So how did you start learning about the importance of joining these associations at the state level? Like what sparked your interest in pharmacy advocacy?
So I got exposed probably about 2005. But around 2005 is when I started to see it. And to be very honest, one of the biggest gaps we have right now with our membership is that new practitioner. That practitioner who's recently graduated to about 8 years out of school. There are some, but there's not enough. And there's a big, big population growth we have there.
Do you think that's because there's a generational information gap? What was going on that exposed you or made the light bulb go off like, hey, I need to join my state organization? Was that in your curriculum? Did they talk about that in school?
There was a club. It wasn't emphasized, at least that I can remember. What I think the biggest problem is, AAPHA, ASHP, ACCP, all the national organizations, nothing wrong with them. They get so much exposure to be a member of, and everybody joins them. And I really don't have a problem with it. I really don't. Because they do represent your voices down in Washington, D.C. But I get my license. I've been granted a license from the Commonwealth of Pennsylvania to practice pharmacy. Every pharmacist that's practicing out there has a license from at least one of the 50 states and or Puerto Rico or Washington, D.C. or the U.S. Virgin Islands or Guam. So you're not given a license from the FDA, the CDC, NHS. You're given your license to practice because you pass the requirements of that state, which in this country we have dual sovereignty. The United States is sovereign, but so is every state is sovereign unto itself. Knowing that, who's representing your voice in people of Pennsylvania? Who's representing your voice in Pennsylvania, in Harrisburg? It's the Pennsylvania Pharmacists Association. We are the ones who have a lobbying firm and retainer. We are the ones who have a pharmacy political action committee, in which some of our members, including myself, are trustees, right? Responsible for moving the agenda forward for pharmacists. Everything that I've seen that has happened negative to pharmacy in 25 years practicing as a pharmacist, not including my years as a student and intern, everything that I've seen is because we have not really stuck together where it really counts on the state level. So you have a unified voice. When pharmacists were going to get approaching the politicians in Harrisburg, the legislators, about vaccines and allowing us to be administrators of vaccines, we got pushback from the Pennsylvania Medical Society. I've asked a previous president of that society, hey, what do you have against, who's actually a cardiologist, so it's a heart doctor. Do you have any problem with me vaccinating your patients? No, Darryle. I'm good with it. You don't have any problem making sure that your patient's taken care of with the proper vaccinations so that they can prevent disease like meningitis and pneumonia, so forth as COVID, flu. I love you guys to do that. Well, then why does the medical society have an issue with it? Why were they pushing back when we were going for that and to get that codified into law? Well, because one of the constituents of the Pennsylvania Medical Society are the pediatricians, who thought specifically we were going to try to take their business. No. I want people to see their pediatrician. Every parent should take their kid to the pediatrician on a regular basis, not just sick, but for well visits. But we know with 59% of the people being in underserved communities, with pediatricians being maxed out on their patient loads, right? We know there's people who slip through the cracks, whether it's migrant workers who are undocumented in some cases, whether it's people who just don't have the knowledge, the literacy, the healthcare literacy to know who to get to. There are people, right? So who's filling in those cracks? It's the pharmacist. Why? Because you can go down your street and find a pharmacy. You can just walk in, no appointment needed. And we're not going to charge you, $25 to see us, right? We'll talk to you for free.
Again, are the middleman, again, helping catch people in between what they're doing at home and when they're in front of their doctor.
Correct.
Yeah. And the vaccinations example is a really wonderful example because that status can differ state by state. I don't think that we really think about that much. Even from what you shared with me, it's encouraging me to get more involved because I'm not active. I am one of those people who are in national organizations, but not involved at the state level. And just this conversation and the conversations past is putting a light bulb in my head. Like, yeah, I should be putting the bulk of my energy and attention to what impacts me and my ability to practice at the state level, and then overflowing that into the national level. So we know that there are state-related things that impact how we can practice as pharmacists, but also how we can make sure that our people in the state, our patients in the state are taken care of. But how does the state organization impact national policy, right? Because federal law, I believe, will trump the state law. Whatever is most rigorous wins. How does the state organization impact what goes on nationally?
If you belong to your state, your voice can get heard. And it's easier to get your voice heard because we're dealing with a smaller staff than they do on those national associations. We're dealing with your board of directors, your officers are often people have phone numbers to, have emails to. I'm very accessible. As I always tell people, I'm not hard to find. So you can you can give me a call, you can email me, you can text me. I've received all of that over various hours, not just during 9 to 5, but I've been contacted on weekends and on holidays and in the evenings and about various issues, right? So that's stuff, and it's not just coming from our membership. I've been contacted from legislators. So, your voice can get heard easier if you belong to a state association, and then we just filter that up to our CEO, who takes it to the national organizations because they're constantly in contact with her.
So the CEO who's having the seat at the table at the national discussions is responsible for bringing the voice of the state. And if you are not making your voice known at the state level, then that opinion, that experience is not captured and it falls void.
Correct. Every state association will either be run by an executive director or a CEO who manages the day-to-day staff, right? The board of directors, or that person will report to the board of directors, which is made up of membership. And so the board of directors can direct that person to do what they need done. It's not hard.
And so you shared challenges or the downside of not being involved. Can you share a success story where your pharmacy advocacy of the state organization made a tangible difference in legislation, patient care, pharmacy practice?
Okay, so I can name a bunch. But we'll start with two places. You know about the PrEP Act, the federal legislation that allowed us to give vaccines during COVID because it was a federal emergency. I don't know the name of the act,
but yes, I'm aware of the...
We got that codified into state law because we showed before COVID, we were able to vaccinate kids for flu and adults. We were allowed to do two things, which was an advocacy unto itself. So we advocated for law to be able to vaccinate. We got pushback, so we were only allowed to vaccinate adults for any vaccine in which we had a CPA with a physician and appropriate insurance and appropriate training. So we had to get an add-on to our license to be able to do that practice. So that was an authorization add-on to our license. Most pharmacists have done it. There are some who have chosen not to for whatever reason. But that was an advocacy to itself. So we were only allowed to vaccinate 9 and over just for the flu. So then COVID came, PrEP Act that allowed us to vaccinate anything under the sun 3 and over. So we showed, because who was the profession that led the vaccination effort? It was us. It was us. And I can tell you some places I actually vaccinated. And it's not just me, all my colleagues. I can tell you, I know a past president who was running COVID vaccination clinics and other vaccination clinics basically 7 days a week during COVID, during the heart of COVID.
Man, this really is inspiring me to get involved. But I also want to bring back my mentality of where I was at when I graduated. New graduates, our top concern is getting a job. We need that first job. We need to get our foot in the door. We need that experience. And then there are pharmacists who are burnt out coming right out of pharmacy school. They're burnt out working every day in this industry. So we're hearing the benefits of joining a pharmacy organization. For those who are watching who are still not convinced that this needs to make it on their priority list, what is at stake for pharmacy if we don't become more active and involved?
What is at stake is, 1, your livelihood. Okay. But 2, if you don't get involved, you don't have a seat at the table. You don't have a voice in how your profession is being determined. And if you really care about patients, which I believe all the pharmacists do, you're potentially harming your patients because they're doing things to you that are harming your practice. You harm your practice, you're harming your patients. Okay. Yeah. So what's the first rule? Do no harm, right? So if you're going to do no harm, if we're serious about doing no harm, and look, we're not talking about people making mistakes because we're human beings. If we're serious about doing no harm, then you got to be all in for your profession, right? This is your profession, right? This is my profession. This is your profession. This is everybody who's in the pharmacy world's profession. At the end of the day, right, your failure to not be involved with one of your state associations, right, whatever state you belong to, is you losing your voice being represented at your state capital. You're losing your seat at the table of having your voice heard. You're losing the ability to dictate your profession, to truly dictate your profession. You know, all this stuff, well, I dictate my own practice. You know, yeah, to a certain point. Yeah. Got to follow the law. You have some cool ideas, but if they don't get codified into state law, can't do them. What is the purpose? Oh, I got a cool idea that could do this, do that. Hey, great.
Yeah.
We got to get it there. There's a lot of opportunity there.
What I'm hearing is we tend to tell ourselves, right? We even see this when it comes to our country elections, that my vote doesn't matter. What I have to say doesn't matter. What's going to happen is going to happen anyway. And then when things go a way that we don't like, we tend to complain. But when we had the opportunity to do something about it, we chose not to. But the individuals are the people that were getting involved in driving huge change. And I think that is a really big take home. But people who are listening were like, well, I don't have the time, the capacity, the experience to do all of that groundwork. How can I just get involved with where I'm at today? I have 5 hours a month, maybe, that I could give, right? How can I get my foot in the door? How can I make a difference with what I have now?
That's an outstanding question. And I often say this because, you know, I might be extroverted, but most of my colleagues aren't. Most of my colleagues are introverted. And like you said, most people don't have the time because their husbands, wives, they have kids, they have to get to soccer practice, they have to get to dance rehearsal, they have to whatever, right? They got a lot of stuff going on. I totally get it. But everybody can do something. right? Literally everybody can do something. So what is the something? The something is taking 30 seconds out when there's a call to action from your state association, when we're getting close to doing something very positive for you and we need that final push. Taking 30 seconds to email your state rep, your state senator, right? Like that, we make it so simple. We'll do the letter for you. All you have to do is stick your address in. Boom, out comes your state rep, state senator, right? And all you have to do is agree to submit, and the letter gets sent on your behalf to the appropriate person. It literally takes 30 seconds.
So you're saying that there's work being done in the organizations and they outreach to their members, and they ask their members to submit whether it's a yay or nay on this policy they're trying to do, and all they have to do is say yay or nay and send it in.
Detail a letter to the state, the state legislator, state assembly, and the letter could read, thank you very much. We're looking at blah 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 blah. And when we do a call in action, you click one button. It'll ask you to put in your address, put your name and address in. How long does it take to put Darryle Tillman, blah blah blah, Rose Valley Road, blah blah blah, where I live. Boom. That's 10, 15 seconds. Boom. It says that your state representative is this person, your state senator is this person.
Yep.
Hit submit.
But if they're not a member of the organization, are they getting that email? Are they getting that outreach?
No. And that's one of the reasons why they should join. I mean, so let's say you don't have the time, right? We could, like I said, we can always do something. There's other things you can do, right? We could go up in Pennsylvania. Most people's state reps are within it. Depending if you're in an urban area, they're usually a couple blocks away down the street from where you live. But if you're in a suburban or rural area, like mine's, I'm in a suburban area. Mine's is about a 5-minute drive to the office of my state rep. And if you're a more rural area, it could be a 15, 20-minute drive. But most people live within 15 or so minutes of their state rep's office or state senator's office. So if you have a few minutes, take a quick drive down there and express your thoughts on some of this stuff. Because let me tell you something. The people in the state legislature, state assembly, they know an inch deep, 1,000 yards wide. They know talking points. They know what their legislative aides tell them. They know what they see on these commercials or mailings they get. They do not know in depth of all the subjects. This is a vast, it's not just pharmacy issues that are up there at the state capitol. And in Pennsylvania, we don't have one pharmacist in the state assembly. So they really don't know our issues. They only know what we educate them to know, right? And of the 253 people that are representing us, either in the 50 in the state Senate or the 203 in the state House, one has a spouse who's a pharmacist. So he actually gets told. So we have the responsibility to educate those people for not just our members, but for the greater good of the public, right? Like, they want to know, hey, how come my communities are losing all their pharmacies? How come my local pharmacy closed?
Or how come
this is the reason
in line for 30 minutes
and this is
to get my atorvastatin?
It's not because it takes 30 minutes to count out 30 pills and slap a label on. It takes 30 minutes because you may have issues trying to bill it. And if it's not the community pharmacy, you have a line building in the cancer center of people who need to get their treatments. Or a line building in the ER of people who have yet to be seen. From anything from a sprained ankle to a heart attack or whatever.
Yeah, very, very true. I work in transitions of care. So a lot of entities may not want to pay for transitions of care pharmacists, but then their patients are being readmitted at a higher rate. And to your point, that is stressing the hospital system that's already fighting for their life.
And it's one of the most important jobs in pharmacy right now. Because let's be honest, if the discharge medication reconciliation isn't done right, when they come back, nothing will be right on the admission end. Right? And if it's done properly, you can keep the patient out of the hospital. Like An old friend of mine who I worked with, the pulmonologist, one time told me, he used to say, hey, if you have an asthma problem, come to the office, I fix you for $50. I got to admit you, it's at least $2,500 to fix it because of all the costs that's associated with an inpatient stay.
Yeah. I want to talk about, we helps the person who is thinking, how can they do the least amount of work but still make a difference? And there's nothing wrong with that. And that's probably going to be me where I'm starting. But then there is someone who has that political affinity. And they're like, one day I see myself being a vice president elect and maybe even a president or an officer. What would be how would they get there from A to Z?
So, first of all, that's a great question. I never actually seen myself as being president like the PPA ever. Even when it was peeped in my ear to run, I never thought in a million years I would get elected. So I think everybody has the potential of doing it because I never seen myself in this capacity or in this role, and here I am. And so that's what it's an honor and privilege, right? Like you do understand that you're their servant leader. You're being leading from the service you give. So that's number one. So I work very hard every day to try to make sure I hold up my department. But if you have the desire and you say, hey man, one day I want to be the president of that pharmacy association. First thing I would tell you to do is first you got to join. Right? So let's assume they did that part. You want to get involved with at least one committee work. Every pharmacy association has various committees, whether it's membership, whether it's advocacy, whether it's health policy, whether it's the conference committee, right? The education, right, committee.
So we become members, we join committees that are available, and it can be any committee that they have available. Would you say there's like a minimum amount of years that you might want to stay somewhere before you gain the skill sets that would be needed to go to the next level?
I would say it doesn't have to be the same committee, but you probably want to do 2 to 3 years of committee work before taking a shot at a leadership position. I would also investigate if that pharmacy association has some type of program for young leaders that they develop. Like we have one in Pennsylvania called the LEAD program, right? So I don't know what your state association around the country would have, but those are opportunities. And I would assume, I don't know this to be true, that it's a very limited access to those programs on a year in, year out basis because we only take I think 4 to 6 individuals a year for our program. So you have to apply and get in, right? Just like you would apply and get in a residency. So I would assume most associations are somewhat structured similarly, but yeah. And then after, are abreast to most of the issues, then the next natural step would to be try to chair a committee. Most states, at least Pennsylvania, were set up where the chairs are selected by the president. But I know the president, at least here in Pennsylvania, takes all the advice of all the executive officers. So we come together every year, make those decisions, and advise the president. The president does have the ultimate decision on who he or she wants to put on that committee. Or the chair of the committee, not necessarily who goes on the committee, but who's going to chair the committee, and can absolutely dissolve and form new committees as he or she chooses. So we're looking at getting a committee started just to look at our board seats to make sure they're appropriate, to make sure that all the sections of pharmacy are covered, to make sure that there's not a section of pharmacy that is overcovered, to make sure that the board is not too bloated, but not too lean. We have an 18-person board right now. I think it's 18 people, right? We have a couple seats for the students. We have 5 different regions. So that's kind of your House of Representatives. And then we have every practice site, or most of the practice sites covered. We've identified 1 or 2 that we think should deserve a seat. So we're looking at that. Well, then you want to probably run for a board seat. Right? So let's say you've done 4 to 5 years of work for the association. And it doesn't necessarily have to be as a pharmacist. You could have started this capacity as a student, right? We have a student advisory board. Every school of pharmacy, there's 7 in Pennsylvania. They have their own chapter of PPA, right? They have their officers. So I would feel completely comfortable if a student were running for the board, or a new practitioner were running for the board 1 or 2 years out of graduation that had 2 or 3 years of experience while they were a student, working for their student chapter or sitting on the PPA board as either the student director East or student director West. I would feel completely comfortable with that because they put in the time, right? They understand what will be required of them when they get to that seat, right? And then obviously after you've done that, a lot of what happens at least in PPA, a lot of what happens is we look at the people and how they've worked as board members before we start peeping in the ear about running for an officer position. We really look at the board as a springboard to the officer position. It depends on how you worked. Have you put in that time? Have you shown that commitment? Are you, game for the effort that's going to require? Because it does takes a lot of. I've gotten woken up. Remember the change switch that went down last year? Yeah, it that was an 11:15 p.m. text message from the then president, right? It affected the whole country. It affected the whole country, but the officers all got woken up at like 11:15. Hey, we got a problem. We need to do something about it. So, and that's around the time where your toes are getting nice and toasty in bed, and you're just about into that nice deep REM. So those things happen. Got to be prepared.
That's good for us to know. We have become a member, and you can do that in pharmacy school, or you can do that after you've been working for a little bit. Then you want to join a committee, something hopefully that you're passionate about, because that's going to be easier to be involved in. While you're in these positions, you're really getting a landscape of the organization itself, as well as the issues that are going on statewide, nationwide. You're also learning about the positions up top and kind of seeing if you would like to do that. If you do, it sounds like the next place would be co-chair, and then we do board members, and then we start thinking about running for the office positions.
And not all of that has to be linear, right? Like I actually served 4 years on the board and was gone for 2 years. And then I came back. It's like, it was almost like the current president 2.0, right? It's very interesting is by having that little gap though, when I did come back, I came back not only as a new member on the board, but as the board historian, because I was able to reference to decisions that had been made back in yesteryear. So that actually put me in a very unique position because I could speak to stuff and other members didn't understand why did we already have that or why did we do that. And I could say, hey, this was the thinking of the board at that time.
That's good.
Various issues.
And I like how you're also dropping in the information about students to get involved, because it's good for you guys to know what students are going through. It's important to hear what's going on at that stage of your pharmacy career as well.
I one time had what I consider a mentor, a former PPA president, Rob Frankel, who one time told me, Darryle, you either get into politics or you get out of pharmacy, right? So you have to advocate for your profession.
Was he speaking to you as Darryle Tillman or you as a pharmacist? Both? Would he say that to any other pharmacist?
Both. It doesn't mean you have to run for president of the United States or governor of Pennsylvania, but you should get involved. It doesn't mean you have to even run for your local state rep office. Just get involved, right? Like the reason why it's called a republic because it's the people running, right?
You, in the beginning, you shared how you've seen it change over the past 25 years. I am curious, in your position, the things that you have access to, the oversight you have access to, where do you see the next 5 to 10 years shifting based on emerging trends?
Oh, it's such a good question. So some of it is in the technology, right? And there's been a lot of technology changes in 25 years. It's a quarter century now. I remember when you used to have paper charts, right? And we don't do that anymore, right? We all have computer systems or electronic EHRs, electronic health records. I remember when we used to have paper orders, right? How many people actually get a physical paper script anymore? Everything's set up, right? You don't even have very many phone call-ins anymore. Most people just, because everybody has one of these things, right? But I think the next big thing is, and we actually talked about it at our recent annual meeting, is AI. Artificial intelligence is going to be huge in the profession moving forward. Now the question is how we use artificial intelligence. Because I think it has a place, but you have to pick your spots, right? Because done inappropriately could compromise patient privacy, could compromise a lot of stuff. But there is a role for it. There is absolutely a role. You can do it in education. You can do it in automating your systems. There is spots for artificial intelligence, and I think that's
have an idea of where those spots would be, where it can be helpful.
I think one of them will be education at some point, and how we educate not just our patients, but do education for other professionals. Right? I think another spot will be in distribution efficiency, whether that is in the mail order pharmacy space, whether that's in the specialty pharmacy space. At the end of the day, I don't care how good artificial intelligence gets. AI can get, to the world and back, right? Like your brain is going to operate faster than this. Your brain is going to be able to do more than
if you
this,
utilize the muscle. If you don't use it, you lose it.
True.
I can't do mental math anymore. I was better at mental math in high school than I am right now.
I believe you still are. I think it's just like riding a bike. You might be slow coming back to it as far as, you won't do it in 2 seconds. It'll take you 4.5 seconds. But I still think you could do the mental math, right? Now I do math all day. So doing mental math is one of my stronger suits because I do it all the time. But, if I go on vacation, when I come back, I'm not as fast as I was before I left. But, you still have the opportunity.
My concern, well, there's the big concern for AI, right? Everyone, it doesn't matter what your job is, everyone is worried that AI has the potential to take their job, quote unquote. I also worry that it's going to weaken our pharmacists. I should say, I and colleagues have seen a difference already in virtual learning. The students and how comfortable they are, how knowledgeable they are when they graduate, that had to undergo virtual learning during the COVID season compared to students who were learning in the classroom. So I have already seen how technology has, quote unquote, weakened or positioned people to not be as knowledgeable, not be as proactive about making sure they know their information because they're relying on the internet, because they're relying on the new age AI. Those are my personal concerns. Do you see a world where pharmacists could be replaced by an AI system?
No. And here's the reason why. Why I agree with what you just said, right? A lot of things, like for instance, we have IV automated computer systems that help us make IVs. It's almost like back before we had these systems, you had to actually figure out and calculate, use your pharmacy calculation skills to figure out how much potassium I need to put in that bag. Well, now I have a screen that tells me put this much into that bag, right? Now, two things. One, garbage in equals garbage out, right? So if that system's not set up correctly, then you still have a problem. So you still have to use your brain. Number two, where it can be used as a crutch for a lot of people, it's also a big safety net, right? For those, because we're human beings, right? So, occasionally I get a math problem. Or I get a slip of a finger, you get fat finger, you meant to hit this button, this number, and you hit that number, and you throw your calculation off, even though you know how to do math, right? It happens. So, or we don't read it right that one day, where we think we're looking at 1.9, but we're actually looking at 1.4 on a syringe, as far as ml. So things happen, and those are safety systems to prevent major problems. We don't want to have the Emily Jerry case again. We don't want to have that. We don't want to have situations where people are harmed. So why sometimes I get very frustrated by some of these systems, right? At the end of the day, I know at the end of the day, It's about keeping people safe. So we're going to live with it one way or the other. But there are still opportunities within the human being's brain to advance the cause. So I absolutely believe there will never be replaced by a robot. Parts of our job will be replaced by the robot. Parts of the jobs have already been replaced by robots, right? In different automated systems. I'll give you one example. In the health system, there is a system, I don't want to give the name away, that you can put an emergency code card tray and it'll analyze and make sure all the right stuff is there, right? And tell you, hey, you're short a dopamine vial or whatever. We already had that in place. Or it'll say, hey, this one drug here is already out of date because you accidentally picked up an expired vial because your tech hadn't gone through that little section of the pharmacy to clear out the outdates, right? And it'll pick that up. And it'll keep you from putting an expired drug into a code card tray.
And that was something I remember as a student. That was one of my rules, is going through it. That is something that could absolutely free you up so you can focus on something else. Yeah.
And it's a mundane part of the job. I didn't know one pharmacist who ever looked forward to checking code card trays.
Yes.
It was necessary. You have to do it. But that's when it became work. It's like, ugh. You know, especially if you have a patient who codes 3 times, right? And you've seen this nurse trudge down to the pharmacy 3 separate times in the course of a few hours, and you got those trays stacking up, and you know you got to get them checked.
Well, I feel like we have talked about a lot. You have given us a lot of information. You've given us the what, the why, the how of pharmacy advocacy and how to getting involved at the state level and still encouraging people to be involved at the national level as well. It's not a this or that, it's an and. Really is what the take-home message is. Before we close, is there anything that you would like to share with the audience that we haven't touched on?
So 2 things. One, people tell me, hey, I got to pay a couple $100, you know, for this membership. I've heard it before, and I already belong to these 2-3 organizations, and why should I join yours? We already touched about the importance of the State Pharmacy Association, but I always tell people, like, listen, at the end of the day, your $260 or whatever it is. First of all, I've actually verified this. At least in Pennsylvania, that's worth over $5,000 in value. Between the education, the advocacy work, all the different nuances. Wow. I actually verified, because when I was chair of the membership committee way back when, I actually gave an assignment to the staff to come up with an actual value of what this is worth. At the time, it was like $4,800. What does our journal cost? What does this cost? So how does this all add up? And so I had them go back, do a little bit more work. And then when they brought it back to me and they gave me the actual number, and I think at the time it was $4,800. I actually went line by line. Where'd you get that number from? Where'd you get this number from? I verified it. So I can tell you now that number's over $5,000, right? For what we pay for.
Where is that value coming from?
And
because on our end, we're putting out this money and we're paying for our state recertification. If we're board certified, we're paying for that. If we are CPPs, we're paying for the list can go on in pharmacy licensing.
That's an excellent question. The value comes in a couple different major buckets. One is education, right? Well, at least I don't know about other state associations where I'm at in Pennsylvania. CEs are free for the members. So we have a lot of live CEs. We have a lot of home study CEs. Obviously, when you come to a conference, there's a ton of CE, right, that you get in the cost of registering for that conference. But there's stuff that's covered in the conference. And for whatever reason, you know, you may not be able to get to that CE because you were doing something else at the conference that will rerun a couple months later, right, and give you an opportunity as a lunch and learn. So there's that. That's a big cost, because the cost of doing CE from an administrative operational, I know the person who gets the CE is not getting compensated, right? So the person usually is a resume builder or something to add to their CV. But the cost of keeping ourselves accredited and all the work that it takes and all the stuff you get, that's a lot of work. It's a lot of cost that most people don't know. I mean, thousands and thousands of dollars. Okay, so that's a big bucket. And then the other big bucket is all the advocacy work. What's that value? Well, I don't want to disclose how much we pay. We pay a lot of money for the lobbyists. And not all the work is done by the lobbyists. A lot of that work is done by the advocacy committee, by our own members, right? People, your officers, people like myself, right? People like our president, our vice president, board members, PPA Farm Pack members, advocacy, the independent owners. There's a lot of people that do that work. And there's a cost associated with that. So there is a cost to that is part of your membership value. And then there's a third bucket, which is the different offerings we have beyond education of being able to take advantage to get new revenue streams. Like we have the PPCN network. It adds a new revenue stream to your business. We get a capsule. We get a newsletter hit twice a week on our email every Tuesday and Thursday telling us all the news, both on the federal, state, local level. Anything that's fit to print in the world of pharmacy gets reported out to membership every Tuesday and Thursday. So this is the stuff. And last time I checked, I don't know a pharmacist who's making under $100,000 a year. Your membership fee for whatever state is protecting your $100,000 a year job. And it's very important that most people understand that.
And why our rate is our rate.
Protecting your $100,000 a year job.
Yeah.
Okay? And that's on the low end. And so I'll leave it with that, and I will leave everybody with this. Everybody can do something. Okay? We determine, like the old poem Invictus, right? I'm the master of my fate. Right? We can determine our fate. We can be the people who determine where we're going to go with our profession. It is up to us. Every good thing and every bad thing I've seen in 25 plus years of pharmacy has been from us, one way or the other. So we do not have to tolerate things that don't work, and we have the ability to duplicate and enhance things that do work. So at the minimum level, get involved. At the minimum level, always advocate for your profession. And if we all have discretionary income of some form or fashion. Just use a little bit of it, smidge, on your profession. Give back a little bit, right? And understand that as far as leadership goes, this is a baton race, all right? I'm running a leg of the race right now. But soon and very soon, baton goes to the next person. That I'm not a dictator, I'm not a king, I'm not going to be in this role forever. I have it for a small period of time. I will give you my very best. But at some point, gotta hand it off. So the next generation, y'all should be getting ready. All right? I have gray hair, but when I started this, I didn't have any gray hair in this beard. Get ready, because your time is coming quicker than you think.
I am already looking back. Like, I graduated 5 years ago. Like, it goes very fast.
It goes fast, doesn't it?
I'm seeing little gray hairs like boop, boop, and I'm like, hold on now. Hold on.
I remember being 23 years old coming out of pharmacy school, and here we are, 25. I can't believe it. I really can't. I can't believe it. And I feel so fortunate and blessed. I feel so fortunate and blessed to be in a position where I'm at, where I can help my colleagues, where I can take care of people, where, I have the ability to wake up every day and make some sort of small difference. I am living the most honored and privileged life that one can live. And I don't make $1 million a year, and that's okay. I have the opportunity every day to do something extraordinary. When it's all said and done, I've made a little bit of difference.
Well, I can't speak for others watching, but you've already made a difference with the way that I think. I will be joining my state organization after this conversation. You have convinced me.
I appreciate that for whatever state you are currently residing in. And yeah, do that. Get involved a little bit. I know you don't have a lot of time, neither do I.
I can send an email off, though.
You can find some time.
I can put in my name and my address.
Yeah.
I can do that right now. Yeah. So thank you so much. And I want to say thank you for the work that you do. For the people such as me who are just benefiting from the work that gets done, right? that we don't even know all the work that's going on behind the scenes for us to have the privileges that we do have now. I do want to say thank you. And
well, I thank you for this podcast and exposing our profession to the masses, right? Like, so I've never done a podcast before, right? But you taking the time to do this. So I appreciate the fact that you've put the profession on exposure, right? Like, because most
maybe
people
not,
don't know
no.
what a pharmacist really does. They only see what they see when they walk into the little pharmacy. But there's so much more, and we know that. But you're the one who's actually doing the work of exposing it. So I appreciate you. I thank you for that. And I seriously look forward to what the next generation is going to do. It's
You
all
have
going
to
to
stay
unfold.
in touch with the next generation. That's extremely important. So I hope they are watching. I really do. All of you who are watching, please consider everything that was said today. Think about where you fit into all of this, where your fellow pharmacy friends fit into all this, your patients, your family, your friends who receive healthcare, where all of us fit into this, and figure out where you can do your part. So thank you so much. This has been wonderful. This has been great. Again, I appreciate it, and
Thank
I
you.
think we are going to close here. That this has been a wealth of information.
I appreciate you. Appreciate your time. Thank you.